Hello, everyone, and welcome to another great Talk with HIROC live stream. Thank you for joining us. Today, I am welcoming Wolf Klassen, Vice President of Program Support from Michael Garron Hospital. Wolf, thank you for joining us.
Thank you, Mark.
All right, so without further ado, we'll jump right into the questions. Today, we'll be talking about the current vaccination operations, as well as the community support surrounding that. And so the first question I want to ask you is, what are some of the learnings that you could share with our subscribers around partnering and collaborating with the community?
Well, thanks, Mark. Yeah, we're obviously very excited to be part of this mass vaccination or the vaccination effort for the province of Ontario. We've been at this since the end of December. And since that time, we've really been working with others because this is a Herculean task. And it's not just up to one organization. In our own community, there are over 300,000 people. And you can imagine that that would take quite a lot of time if it was one organization responsible for vaccinating that many people. And so we've certainly been working very, very closely with many other organizations, including obviously the Ministry of Health, Ontario Health, and Toronto Public Health. In terms of some of the learnings, it really starts with what is already in place that we can leverage. And we have had an Ontario Health team here in East Toronto, our East Toronto Health Partners, and we've really used that opportunity to build on the great work that we've been doing with our community partners. So it's really building on strong relationships. And it's obviously helpful when those are already in place, whether that's with primary care or with community-based organizations or long-term care. It really takes all of us to work together and to build on each other's strengths. So we have had examples of establishing job fairs when we were trying to recruit a number of people for our vaccination sites. So we worked with Wood Green Community Services, hosting a job fair where they helped us to recruit 58 of our 200 required roles. We've also seconded people from community organizations such as South Riverdale CHC. We've also worked with Flemington CHC in terms of their community ambassadors supporting our mobile in various apartment buildings in hotspot neighborhoods. Health Access Thorncliffe Park and Thorncliffe Neighborhood Organization are two other organizations that we work with very closely that help us actually book the people we're trying to reach into our booking system in order to get their vaccine. And of course, working with primary care to help them establish clinics in their own space. And also they have helped us in our pop-ups and in our mass vaccination site in terms of medical coverage. So there's been a number of ways in which we have partnered and worked with our community and with community organizations. And then, of course, there's also the community members that we're involved in. They're on our steering committee, they're on our vaccine confidence working group. When we reach out and do pop-ups, we are working with the community ambassadors that live in various buildings and communities. So it really takes all of us to work together.
Yeah, absolutely. And that's, very encouraging, very inspiring, very fantastic to hear, especially, considering, the circumstances and what's happening now. And of course, you mentioned, the power of working together and kind of working with those relationships that are already established. And so I just wanted to know that, what steps have you taken inside your organization to make sure that you have, the right folks at the table?
Well, it's probably also about relationships internally as well. But we made sure early on that we had a core team in place. We established clear executive leadership and functional leads for each of the areas, and really implemented sort of an IMS incident management system structure with a clear command and regular checkpoints. We have the executive table that comes together almost on a daily basis. We have the operational leads that certainly come together daily because we know that things keep changing. On this rollout, there have been so many times when the word that we refer to, okay, where are we pivoting today? And so in order to do that, we really need to have clear lines of communication and figure out exactly how we escalate things, how we reach out to our community partners, and how do we work with external partners as things continue to evolve. So need to plan for redundancy as we've set up our own command structure here, because this started in December, and I can tell you many people for the first 2 months did not have a day off. And so we recognized very early on that we really need to build in redundancy in our key roles.
Right. And you mentioned that point about how, even now, like, things are constantly changing, constantly evolving. You always, need to be on the lookout for what's next. And, and in many ways, it's also a learning experience. What do you think are the key or the risk and safety concerns that subscribers should think about when working with community partners and other vaccination work?
Great question. I think we have found that having clear agreements in place is very helpful. So whether that's with staff or physicians, especially when they're coming from other organizations to help support the vaccination efforts here. So making sure that credentialed staff go through the proper credentialing process within your own organization. This is particularly for physicians that are coming primary care who may not have been part of your credentialed staff. We also have secondment or employment agreements in place with staff that are coming from other organizations. I think the second area to pay special attention to is ensuring that there is sufficient training for clinical and non-clinical roles. These are new roles for people working with new team members, and so making sure that there are sufficient training opportunities in place. Having clear roles and responsibilities, again, especially when we're doing our mobile or pop-up clinics. So, when we're going into a different building every day or putting up a different pop-up in different locations, just making sure that we know who's doing what so that no patient gets missed, being very clear in terms of who is obtaining consent, who's entering the data in COVAX, who's booking the client for the second doses. And again, in some of our communities, we're dealing with a lot of people where English is not the first language. I think the other risk to pay special attention to is that this currently, until we get into the third wave, which we're into now, and that will become, the top media story. But right now, the rollout of vaccine is the top media story. And so we've had a lot of interest. And of course, that can be very good. But you need to also, work carefully when there is so much scrutiny from the media, from a public relations perspective.
Absolutely. That's very understandable. And as you said, having those agreements in place, the trainings in place, and it's a massive logistical kind of operation. So it's really critical that everyone understands their role and the proper trainings are in place. So what's next for you, Wolf, in terms of what's next for your team in respect of the community reach out or other ways that you're supporting?
Thanks, Mark. What's next? Well, pivot again is the key word for vaccine rollout, and I think currently the challenge that I think we're all facing is the supply of vaccine compared to the demand and the need that's out there. And certainly, again, with the third wave well underway, it's really important to get shots in arms as quickly as possible. And so, we could do probably 5 times more than we're currently doing. We have the staff in place, we have the sites, we have the partnerships, we have the systems, but there is a shortage of vaccine, and there certainly is the demand as well. So I think that is the number one challenge for us right now. In terms of other things that we're doing now, our own hospital has a number of priority FSA, forward sortation areas, and hotspot communities. And so looking at different ways, not everyone wants to come to a mass vaccination site. So obviously work very closely with community organizations and putting up mobile vaccination sites in other areas, working very closely with primary care because a lot of people want to come to their physician's office for their vaccine. So we're working with primary care and supporting them. We're doing a lot of pop-ups. We started that this week in some of our hotspot communities, and that has been very, very effective in reaching a lot of people. And so I think today is our third pop-up. We've got several planned for this weekend, so there are no appointments. We have learned to give out cards. So when people arrive, we give them a card. We tell them what time to come back, because you're just overrun. The word of mouth spreads. And these are pop-ups. There's very little advertisement. It's not on social media. But the word of mouth in these communities spreads very quickly, and people are very excited to the fact that we're coming to them and removing barriers for them.
Right.
And so we're certainly seeing that. We're going into mosques and churches, into strip malls. We can use the parking lot. So that's where we're going these days. That's what's ahead for us.
Yeah, and that's awesome to hear. And having multiple places where people can get vaccinated, as you said, word of mouth spreads. As a communicator, again, we can't underestimate that the power of that. And everyone wants their vaccine, so it seems like we need to, like I'm very encouraged that eventually we will be firing on all cylinders, so to speak, and getting a needle into every arm.
And so, I should just sort of add one other thing. We're also doing a lot of work around vaccine confidence, because there are a number of people who may be hesitant, and so there's a lot of work that we're doing, again, in collaboration with community organizations in terms of vaccine confidence.
Right. Absolutely. Yeah, and that's very like you said, vaccine confidence, very significant to continue educating and encouraging people. And so, and in your role as vice president of program support, how have you personally been adapting to, again, this evolving situation? Is there, is there an app that you use? Is there something else? Is there something going on that you use to stay energized and motivated and this unprecedented time?
Well, thanks, Mark. I mean, I'll start by saying I feel very, very grateful to be able to work and help support our organization in this effort and helping our community to see that, hopefully what will become a better summer and a better fall. So it's a privilege to be able to do that. I'm very grateful for that. In terms of how I look after myself, every evening, the last thing I do before I go to bed is I send 3 things I'm grateful for to our Fam Jam account on WhatsApp, and that really helps ground me, because there are so many things that I'm very grateful for, like my health and our healthcare system in Canada, and the fact that we are rolling out these vaccines. I meditate daily, I journal daily, and I exercise daily, and I think that those things have really helped me to stay strong for this marathon that we're in.
Yeah, absolutely. Don't underestimate the power of meditation, mindfulness, all these things, getting out, your daily walks, that kind of exercise. Because a lot of the times that that you spend, longer as the pandemic goes on, it can be very stressful, and people are very anxious. But a person in your position, it's great to hear that you are taking care of yourself. And so, thank you so much again, Wolf. I don't want to take up too much more of your time. I really appreciate you coming on to speak with us today. I just have a few comments for the watchers today, everyone watching in the audience. If you have any risk or coverage related questions about vaccination centers, I'd like you to please contact us at riskmanagement@hiroc.com, as well as our next talk with HIROC. It's on April 23rd at 12 noon. It will be showing you, everything you need to know about water emergency response plans. Please tune in, follow us. If you're not already following us on LinkedIn, please do so. And you can watch live at showtime. Again, Wolf, thank you so much for coming on today. Really appreciate your time, and take care.
Thank you, Mark, and thanks for all the great work that HIROC does for all our subscribers.
Absolutely. Fantastic. Take care, Wolf. Have a great day. Bye-bye, everyone.